Expired. I now recognize Dr. McCormick from Georgia for 5 minutes of question.
Thank you, Mr. Chair. I'll cut straight to the point because I know we're on a timeline and I'm the last, so congratulations on that. I want to point out that it was President Trump's Operation Warp Speed that had unprecedented delivery of a vaccination in record time. I think it's ironic that this scientific achievement will forever be tainted by the government's handling of COVID-19 and the mistrust that was created from this vaccine policy and the federal programs that surround it. To avoid myself of partisanship in this case, I'd like to highlight that it's the Democrats that have touted this program that President Trump not only came up with, but received the vaccination himself and admits openly to getting the booster as well. So there are some ironies in this argument all the way around. So the question is, why has America become so distrustful of vaccinations, as my colleagues have pointed out? Why is it that they no longer want to get a vaccination that may have potential benefit? I would make the point, a couple points on this. First of all, when you insert yourself between a doctor and a patient, and some doctors contradict you and you censor them, even when you're not a doctor treating patients, people are going to say, why does the government have authority to do that? To censor my doctor. And then secondly, when you start requiring people to do something instead of encouraging, the natural resistance of a freedom-loving people that were founded on those principles will be to resist what you're requiring. So it shouldn't be any surprise to us when the people say, I'm not going to do what you're telling me I have to do, when my doctor may agree with me and not you. You're the government. Why do we assert ourselves in inappropriate ways? And really, when we talk about the evolution of science, when you have immunity and you're still requiring a vaccination that can cause a hyperimmune response, which we're all scientists, we can admit to, there's risk versus benefit on every decision. When the government says we're going to make a carte blanche requirement without taking science into account, it's no wonder people are mistrustful of our recommendations. This is the problem we have right now. So let's talk about the vaccination liability and compensation program. It came to my attention last February when I heard from constituents that COVID-19 vaccine injuries, the claims that were sent to CICP, were constantly lost, ignored, or denied, or caught up in the bureaucracy with little or no transparency. Now, of March 3rd of last year, several of my colleagues and I wrote a letter to HRSA about our serious concerns regarding the countermeasure injury compensation program, the CICP, and its failure to respond to our constituents in a reasonable time frame. Now, first of all, I appreciate Commander Grimes. I will say, unlike a lot of the government agencies we were at, you responded, and you actually came by my office, and I do appreciate that. I think you care. And you also point out that you had a very small, when you started out, you had, 4 people working for you, which was based on a pre-pandemic response force on injury that can cause, and you were trying to respond to 13,000 people with 4 employees. Since then, you've been plussed up to 35 people, I believe. Am I accurate in saying it was 13,000 claims approximately?
We have approximately 13,000 COVID-19 countermeasure claims, about 9,600 of which allege vaccine.
Okay. And of those, which ones how many have been closed?
2,200 about.
Yeah, okay. And then the number is 35 employees now that are handling those claims, right?
Yes, so since we...
it's okay, I got to be quick because we're on a timeline here.
Understood.
How many claims are we processing per month now?
So in the year 2023, we processed 90 claims per month over that year, okay. And that velocity increased throughout the year.
And of those 2,200 claims, how many have been shown to have some merit for injury?
Currently, there are about 40 that have been found to have a injury that was directly caused by a covered countermeasure.
Okay, so pretty small percentage, correct?
Yes, sir. Okay,
so just to do the math, that means that each employee is handling about 2.7 cases per month and showing 40 out of 2,200 cases that have been processed so far. Of the 13,000, that means we probably have about 10,800 cases in backlog. I know you've asked for more employees so you can process faster, but at 2.7 per employee, it would take us about 10 years to process the remaining claims. And the application process to get this denial processed through some sort of appeals process has an even smaller approval rate. It's a judge, jury, executionary. I just don't think it's right. I think we need to streamline this process. You need to, as a leader, in my opinion, we talked about this in my office, make sure that you know what paperwork is required, how it's processed, and we need to spread this process by about tenfold in order to do our job for the American people. And with that, I'm out of time, and I yield.
Mr. Chairman, I'd like to ask unanimous consent to submit this for the record. It's an article from the New York Times that says, entitled COVID Shots for Children. Much of the world has decided that most young children don't need to receive COVID booster shots. The U.S. is an outlier.
Without objection.
Thank you.
I now would like to recognize Ranking Member Weiss for a closing statement.
Yeah, let's just, again, you know, medicine is very nuanced. Our human body is so remarkably, beautifully made, and our physiology is in complete wonder still. You know, taking a snapshot of a time and using it to go back and define the entire experience of COVID in children is, again, misleading. Now, with rates that are low, with information that we have on children, children that are at high risk, immunocompromised, should get the vaccine. And in certain areas where the rate is low, and the risk of getting infected in an otherwise healthy child, then one would reconsider whether that child would need a booster or in this situation. So, you know, throwing these kind of facts out there without the context and understanding is wrong, and it's very misleading. In fact, you know, we've talked about how VAERS here is a screening, not the definitive tool to use the rate of side effects or serious side effects from getting the vaccine. These are individuals who get the vaccine, and whatever they feel afterwards for a certain time period, they report it, which we want them to do that. We want them to do that. It is a way to screen for this, and we want to have high sensitivity to reduce the false negative, but then with this kind of screening test, you have a high false positive. And that's why we need to reevaluate, do more in-depth investigation on an individual basis to determine whether, in fact, it was caused by the vaccine. So we already laid out the reason scientifically why VAERS is not of the 5 systems, the 5 multi-layered system, VAERS is not the system to use as the definitive rate of infections. But to use it, because it has the false positive, is intentionally, falsely misinterpreting the data that is causing vaccine hesitancy. And people know, but they intentionally still speak to it as if it's the definitive data. And that's the part that gets me. That's disinformation. That's not misinformation. That is intentionally giving false information for their own personal and partisan political gain. That's a clear example of what we've been talking about, of politicizing science, okay? So let's just go back and let's summarize that in total, COVID-19 vaccines saved 3.2 million lives, prevented 18.5 million hospitalizations, and saved the United States an estimated $1.15 trillion in medical costs. So when we say that the vaccine doesn't prevent getting sick or it doesn't stop the spread of disease, let's go back and talk about the nuanced aspects of the use of vaccines, which is supposed to boost your immune system. And if you have a high enough immune response to the virus, then yes, for those individuals, it does prevent them from getting sick. Am I right, Dr. Jernigan? Am I right, Dr. Marks?
Correct.
Correct. So by lowering the risk of getting infected, yes, it does prevent getting vaccines for those individuals, okay? But it's not an absolute. But when we talk about absolutes, again, we are intentionally giving disinformation to the American public that they don't work, okay? Now, if you lower the risk of getting the illness and getting sick, or if you increase your immune response enough to prevent symptomatic infection, then wouldn't you say that that reduces the risk of spreading it to other people? Dr. Jernigan?
Yeah, I think the more you can lower the viral load, the more likely you're going to be able to.
The viral load is a medical term that's important to understand. So when you look with the vaccines, increase your immune response, combats the virus, lowers the viral load. If you have a small viral load, you decrease the risk of spreading the disease. Is that correct, Dr. Marks? Do I have that physiology or pathophysiology ready? Right?
That would be correct.
That'll be correct. So would it be correct to say that indeed vaccines reduce the spread and for some individuals prevent the spread of the virus to other people, correct?
So I think we can say that that's a general statement. I wouldn't want to make it as an absolute statement.
Correct. That's my point.
In the spirit of today's
That's
hearing
my
of giving
point,
truthful
is by intentionally using absolute statements like that without the nuances, and and people should know better, they're disinforming the community. And what I said was not absolute. I said it reduces the risk of spread, and for some people, it reduces the spread. So it does, and it can reduce the spread with that nuance. And it is because of the safety and efficacy of these vaccines that we are ultimately able to overcome the pandemic. It's because of the vaccines that we're able to change the vaccine guidelines over time, or our social distancing practice, or wearing a mask, correct? And yes, there is work to be done to promote vaccine confidence in the United States and strengthen existing compensation programs. Yeah, we can agree on that. It requires funding, capacity, human resources. We can fix the systems to help make it better. But there's no doubt that the multi-tiered, multi-system vaccine safety apparatus, surveillance systems, is the best in the world. And we should talk about that instead of focusing on these false positives or false narratives, so that we can build confidence in the American people. So using our platforms as members of Congress to spread false or disinformation about vaccines does a disservice to the American people. It manufactures distrust. Conspiratorial accusations manufacture distrust. Fear-mongering manufactures distrust. And with increased distrust, you increase vaccine hesitancy. With less people taking the vaccine, more people get infected, the pandemic spreads, and more people die. So how does this help us prevent or better prepare for the next pandemic? It doesn't. It makes it worse and puts people's lives at risk and actually harms the American people. So this is the opposite of helping to prepare and mitigate the harms of the next pandemic. So I hope that we can find a path forward in the serious work that needs to be done to save lives in the event of a future pandemic and keep people safe in the here and now from current threats. And as I said when we started today's hearing, we are already in the process of undoing decades of progress in overcoming infectious diseases, so we must handle each opportunity to discuss this matter with immense care before we reach a point from which we cannot return. So I hope going forward, everyone can drop the outrageous false rhetoric that we've heard by some today and instead identify a constructive path forward that protects the people's health. I yield back.
Thank you. This hearing should not have been political, and most of it was not, I would say, today, fortunately. But the fact that it is simply is further evidence this conversation is completely necessary to take place. I can say that I have invested in all sides of the issues around the pandemic, starting in 2020, being on the Intelligence Committee, and also researching what other countries were doing, how are we going to try and treat people, how are we going to try and save lives, right? Learned a lot. As representatives, we're the conduit to asking their questions. It's not easy for them to just call you and get an answer. Although I thank you for taking my call early on, Dr. Marks, during the pandemic. Look, perception is reality. I mentioned that at the beginning. And that's what we have to face. And words matter, because when you say reduce, it's different than saying prevent. And that happened too often. Not necessarily from your voice, but it happened, and that's what America heard. I think it became clear today about the VAERS system. It's not the be-all, end-all. It's the initial recycling can, if you will, and then you decide what actually goes further. But we didn't say that. But it's the only one America saw. It's the only thing that was out there for the public. So what do we expect? And I think that matters. You know, we see things on some of these natural items in the drugstore. It'll say on there, not approved by the FDA as a legitimate treatment, but it's okay to take, but it isn't necessarily going to meet all its claims necessarily. We put that out there. That's an honesty. That's an honest approach to what America is out there. Look, I think there's never been a question that vaccines save lives by anyone. Hey, I'm from Cincinnati. Do you know how much pride in Cincinnati we take because it's the home of Albert Sabin and the polio vaccine? You know, it's huge. That's in our DNA in Cincinnati. We grow up knowing that. We take pride in it. But we can't leave behind those that have been injured simply because they don't necessarily fit a narrative regarding the vaccine safety. We got to take all that into consideration. We heard today patients and parents should have a conversation with their personal health care provider to assess the vaccine, whether it's appropriate for their particular position, condition, whatever. You know, Dr. Marks, I heard you today very caringly, I feel, say you have regret about those under 5 years old that may have died from COVID. But I talk to pediatricians, and some say, yeah, I think they should be vaccinated if they've got A, B, C, D, or E. And I think that's important. One size doesn't fit all in medicine. It never has and never will. That goes back to talking to your doctor, and that goes back to revealing all the data about those that may have died. You know, these are children that maybe would have died if they got the common cold. I don't know. But those are things you have to take into consideration. I've learned a lot about COVID-19. I think if we want to assess somebody's vulnerability, maybe we should check their furin levels, and I won't go into the science of that maybe you all understand, because that's what it takes to cleave the furin cleavage site, which makes it more infectious to humans. That's another story. But you know, this committee, I think we did a good job today if we really look at the facts that were revealed and discuss openly about where our pitfalls are. And I'm not just blaming the government, because it's politicians too. It's politicians that drove a lot of distrust in what was coming out of public health. Look, we just go back to the beginning. President Trump says we need to restrict travel. Dr. Fauci told us that he recommended that we restrict travel. What happened to President Trump when he said that? He's a racist, and politicians say, oh no, there's nothing to worry about here. That's a racist comment, come to Chinatown. Yeah, let's create a super spreader. That's a problem. That's a problem on our side. And that's why I go and say we need to hear from the doctors treating COVID patients more than anyone else. Again, lives have been saved, but we can't ignore the maladies. We can't ignore certain things. I mentioned before, Dr. Marks, you're advocating on Operation Warp Speed. We were with you all the way. But you have a politician saying that, in essence, Dr. Marks, if it's your vaccine, she's not taking it. That doesn't help us. That creates vaccine hesitancy. When a politician stands up and says, if you take this, you're not going to the ICU and you're not going to die. Yet some were going to the ICU and some were dying. That's a fact. And there may have been a lot of other reasons for it. China comes out and says, we've got this under control. The WHO parrots it. Dr. Lane goes to China. They got it all under control. That's the advice given to politicians. So, of course there's distrust, but that came from China themselves. They didn't have it under control. Yet that's what they were telling everybody. That leads to distrust. So we must trust but verify, especially when we're taking advice from an adversary. Look, the risks have to be put out. No drug can run a commercial, regardless of what you think of commercials on drugs. They can't run it without listing all the risks. Doctors have to sit, or it's malpractice if they don't go over the risks. We weren't doing that. And we issued a mandate, said you've got to get it or you lose your job. They go to the drugstore and get it and get their card. Did they have a sit down? I'm glad to hear you all agree today, at least I think you do, that it requires the best practices to have a conversation with your doctor about your personal health. And the better data the doctor has, the better we can treat patients. That's what we're after. Saving lives, treating patients better. I mentioned before about, there's a difference between saying effectiveness data is different than just saying it's effective. There's data that might say it's not 100% effective, right? And we know that. But this is what the public hears. And so they get confused because they know, well, I know some people had an adverse reaction. Why are we saying it's safe? It's not 100% safe. So you may have done work completely 100% right. But if it's not messaged clearly or accurately down the line, it's a problem. I often ask, where's our Surgeon General to be talking about this? When I grew up, it was C. Everett Koop, and people trusted it. The reason I said we need to hear from doctors treating COVID patients, I'm reminded of General Schwarzkopf during the Gulf War. Every night America tuned in to hear what the general had to say about the war, not what a politician had to say about the war. I think that makes a huge difference. We recognize today, gratefully, that we are telling the American people, when we recognize myocarditis as a problem, we did something about it. That's important. That builds public trust. But if it's perceived that we're just ignoring it and mandating this anyway, it's a problem. I question why we quit talking about convalescent plasma as a form of treatment, especially when we knew that the vaccine we had did not prevent you from getting COVID. You just got less sick. Why were we not focusing more on treatments like that were very effective? At least in Cincinnati, I saw that. Why did we ignore natural immunity? I was told I needed a booster to go to Germany. I had been vaccinated, both doses of Pfizer. I got COVID several months later, and the only reason I knew is because I couldn't smell garlic salt. That's the only way I knew. And when I got my antibodies checked, and I wanted to do T cells as well, when I got my antibodies checked, where I'm being told I need a booster, strong number was 40, my number was 821, and I got the lab report to show it. Now, you have a conversation with your doctor about that. Why did we put this aside? And that's what America understood. Why are we not talking about the benefits of natural immunity? Why are we not saying, if you have natural immunity, you are less likely to get another round of COVID? Why were we not looking at that kind of data to see? Those are things we should have done. Actually, I wanted to do that through the military, and Secretary Austin never responded. As a matter of fact, it was 22 physicians that signed that letter to to the Secretary of Defense, and he never responded. Never answered our question, even after several attempts. So we have some things that, we've got people here that want to make a difference, especially going forward. But we can't ignore these hiccups. We can't ignore these questions that the American people have. If I only sat here in Washington, I can't have this discussion with you the way I'm having it. But it's you go home and you're the conduit to the government. And you know what? If we aren't honest, if we can't be trusted, we don't get elected. But they see people in Washington never leave amongst the unelected. Just understand that. That's why it's important we have this conversation. That's why it's important that we do better going forward. And I thank you all for your time today. I appreciate the work that you do. We want to be helpful to make it even better in the future. So I thank you all again for being here, for your important, insightful testimony. With that and without objection, all members will have 5 legislative days with which to submit materials and to submit additional written questions for witnesses, which will be forwarded to the witnesses for their response. If there's no further business, without objection, the Select Subcommittee stands adjourned. Thank you all for attending.